Here's all the grandchildren. She was very proud nan.
Belinda and her daughter Ella remember their mother and grandmother Lynette as fun and caring, but also meticulous with her health checks. So when she was diagnosed with bowel cancer soon after her last scan, it didn't make sense.
Devastated, just absolutely broken. She'd done all the right things. Wave to the girl.
Lynette Taylor had regular colonoscopies due to a family history of bowel cancer. Her last scan was in 2021. The results came back clear. 2 years later, she began losing weight rapidly.
It was suggested that she go back and have another colonoscopy because they were extremely shocked by the way she was presenting physically.
A repeat colonoscopy in 2023 revealed stage 4 bowel cancer. Lynette died 3 years later, aged 78.
I immediately started questioning and investigating how could this occur because she'd been so careful with her health.
Lynette was one of thousands of patients under the care of General Surgeon Dr Liu-Ming Schmidt.
She trusted Dr Schmidt. She'd highlighted the need for it to be careful because of the family history of bowel cancer.
Dr Schmidt performed Lynette's last colonoscopy at Albury-Wodonga Private Hospital in 2021. Belinda had her mother's medical records reviewed by an independent expert. She says, according to the expert, given the size of the cancer found in 2023, there was most likely a polyp in her bowel that wasn't detected in the 2021 procedure performed by Dr Schmidt.
She put her faith in Dr Schmidt that those colonoscopies were going to be carried out to the standard that they should have.
In 2022, another of Dr Schmidt's patients was diagnosed with bowel cancer, despite Dr Schmidt performing 5 colonoscopies over a 5-year period and returning a clear result for all of them. One of those scopes lasted for 5 minutes from start to finish.
There's no way that even the most experienced colonoscopist could achieve high-quality colonoscopy in that time.
Hi guys.
Hi.
Dr Karen Bell has been a gastroenterologist for more than 30 years and has performed around 30,000 scopes throughout his career.
A colonoscopy generally takes something like 20 to 30 minutes, depending on the difficulty of the procedure.
A complaint against Dr Schmidt was made to the New South Wales Healthcare Complaints Commission. Dr Schmidt told a hearing she has been doing colonoscopies in the way that she was taught in her training. This complaint also sparked a significant recall. A total of 1,934 patients across 3 health services were identified as receiving a colonoscopy performed or supervised by Dr Schmidt between 2018 and 2022. They were advised to have a repeat procedure. In 2023, Dr Schmidt agreed not to practice medicine, but returned to work a year later. Dr Cameron Bell performed repeat colonoscopies on some of Dr Schmidt's patients. Out of 1,084 patients who had a repeat colonoscopy, 548 had polyps, 7 had cancer.
It did make me wonder how that situation had developed without anybody putting their hand up and saying, wait on, that's not appropriate, that wasn't a quality colonoscopy.
But it wasn't just Dr Schmidt's rushed colonoscopies that were of concern. Her work as a surgeon was also under scrutiny. In 2019, 79-year-old William Edmonds was rushed to Albury Hospital with a perforated bowel and was operated on by Dr Schmidt. A coronial inquest found during the surgery, Dr Schmidt made a catastrophic error which caused a mechanical bowel obstruction. William then required 3 further operations. One of them, again, involved Dr Schmidt.
A coroner's inquest into the death of Oakland's man William John Edmonds began today at Albury Courthouse.
At the coronial inquest, Dr Schmidt gave evidence that distorted anatomy and extensive contamination made the initial operation difficult, but couldn't explain how or why the error occurred. In 2023, the coroner concluded William died as a result of complications of peritonitis, which was contributed to by the surgical error made by Dr Liu-Ming Schmidt, and recommended the Healthcare Complaints Commissioner investigate. In the years since William's death, the HCCC investigated 13 complaints made against Dr Schmidt in relation to colonoscopies and surgical management of patients over a 7-year period. The New South Wales Civil and Administrative Tribunal found her management of a number of patients fell significantly below reasonable standards. In July, she was found guilty of professional misconduct and suspended for 6 months.
Professional misconduct is the most serious finding that can be made against a practitioner.
Professor Cameron Stewart was a member of the Medical Council of New South Wales, working directly with the HCCC to investigate and prosecute complaints. He says decisions are not punitive, but made for public safety.
These systems, I think, have worked well in this particular case, but they haven't been as efficient as the families wish, and I think the public would wish.
Professor Stewart says after 6 months, Dr Schmidt can practice again, under supervision and further training.
So in the context of the case, she's already had time away from practice. There's an added 6 months that's been brought together with that period of time. So that's a lengthy time for a person not to be able to work. And again, people's reaction to that might be, well, that's too soon. But again, the focus of this jurisdiction is on safety.
Is a 6-month suspension enough?
Absolutely not. Absolutely not. I urge everyone in the community to come forward and lodge their complaints.
7:30 requested an interview with Dr Schmidt and also sent her lawyer questions, but we did not receive answers. Belinda Taylor is now pursuing a complaint with the New South Wales Healthcare Complaints Commission against Dr Schmidt.
I want people to remember Mum for the incredible person she was and not how she died. And I want better healthcare for our region. She was just a beautiful person and this didn't deserve to happen to her.